Hello, welcome to my presentation on the impact of WIC on child obesity. WIC stands for the Supplemental Nutrition Program for Women, Infants, and Children. It's a federal program, and that's where I currently work, and so that's what we're going to be talking about today. So we're going to start off by talking about the problem of obesity. Obesity is defined, as we've talked about in this semester, largely using BMI. BMI, of course, is a person's weight over their height squared, and a BMI of 30 or above is defined as obese. And obesity, there have been lots of studies that link obesity to chronic diseases. So I looked at a lot of these, and there were three main chronic diseases that are linked to obesity. It's diabetes, non-alcoholic fatty liver disease, and cardiovascular disease. And there are a lot of risk factors for these chronic diseases, and so I looked at those specifically, like what are we looking for? Because we don't see a lot of children necessarily with chronic diseases, but we have been starting to see a lot more risk factors for these. So the risk factors, I've just listed a few here, but include high HDL cholesterol, high fasting blood glucose levels, and high triglycerides. So one study specifically I looked at obese children and how often, and non-obese children, and how likely they were to have these risk factors for chronic diseases. And the study showed that children who were obese were much more likely to have one or more of these risk factors for chronic diseases. So this shows that child obesity is on the rise and it is affecting the health of children. And so this is a really problem that we should start addressing. So, a brief analysis that I went into a little bit in the paper. The data for this section of my paper is very strong because a lot of it comes from systematic reviews. One limitation is that, like I kind of mentioned, children with chronic diseases, we don't see that a lot. And so um, there weren't a lot of longitudinal studies following children with obesity into adulthood and if they had more chronic diseases, but it was a little bit more inferential. So that's something to keep in mind, but in general, the data here was very strong, and yeah, pretty logical. So, and then I dive into WIC a little bit. So, WIC was first formed by David Page. He was a physician, and he just saw a lot of infants and mothers who were struggling with breastfeeding and infants who were malnourished. And so he came up with this idea to kind of help supplement formula to these mothers. So, the first pilot program for WIC was started in 1972. The first clinic opened in 1974, and then it became a permanent part of a permanent federal program. And so the overall goal for WIC has been to help women, infants, and children gain greater access to healthy foods and provide nutrition education. So currently, WIC, in order to qualify, you do have to qualify based on income, and it is 185% of the poverty guidelines or below. And then clients are required to have biannual meetings with the dietitian or nutritionists, and they're required to have their iron, weight, and height taken. And then there's a focus on nutrition education. And then, of course, food benefits are given on a monthly basis, and formula, of course, is one of those benefits that infants get. There's also breastfeeding helps. So WIC is a great program. So I wanted to look specifically at how WIC is helping overcome obesity in children. So I looked at some different studies. All of these studies had WIC participants specifically. And so I found a lot of benefits that WIC provides. One big one was that they lowered food insecurity. So food insecurity is when food is scarce in the house or the diet quality is lowered and they're not able to provide enough for their family. And so this is one thing that I definitely saw that WIC helped with that. I also looked at an interesting study. They compared WIC participants and non-WIC participants and diet quality, and they found that the longer you're on WIC, the higher diet quality they had, the family had. It wasn't necessarily better than non-WIC participants, um, but it did improve their diet quality the longer you stayed on WIC. And then we saw that there was increased fruit and vegetable consumption when compared to non-WIC participants, which I thought was really interesting. And then another thing I saw is they compared obesity rates in 2010 to obesity rates in 2020 of WIC children, and they found that the rates has decreased. And so in 2010, it was 15.9% of children, WIC children participants were obese. And then in 2020, it was 14.4%. So that is a really helpful statistic and shows that WIC does help increase diet quality and is hopefully continuing to help obesity rates become lower. So just a brief analysis of this section. The data was a little bit weaker. I didn't find any systematic reviews. A lot of these were clinical trials, and it was a little bit limited. So there wasn't as much support here. So there could definitely be more of that. And then I did dive a little bit into nutrition education in WIC. So I found, and just nutrition education in general, how impactful it is, because I was just kind of curious about that. So I found that a nutrition education, a program, is the most beneficial if it has several different parts to it. So the first one is if it's multifaceted. So it has to target multiple areas of life, so nutrition and physical activity or something like that. WIC definitely does this. It targets like developmental milestones of children, it targets nutrition, breastfeeding. There's lots of different areas that WIC tries to provide education on. And then another part is having multiple check-ins, multiple follow-ups. And WIC, of course, provides this, and so that's a very beneficial part of WIC as a program. And then I also found that having a social aspect is also very beneficial. And then looking at nutrition education and how impactful it is in general to behavior change, there wasn't a lot of studies that I found on this topic, but the studies I did find varied. So some of them were like, yes, nutrition education does provide a great help, and others were like, maybe a little bit less so. So nutrition education does provide positive impact, but the amount of positive impact is maybe a little bit less strong. So something just to kind of keep in mind. So overall, here are my conclusions. We know that children with obesity, they're increasing, and the rates are. And children with obesity are more likely to develop chronic disease risk factors. And then WIC does help lower food insecurity and help overall diet quality. And then nutrition education, the aspect of WIC can help. I'm maybe unsure of exactly how big the impact it has. And then some areas of research I've kind of mentioned, but children with obesity, following them through to adulthood to see how much they develop chronic diseases and if it's more or less than their non-obese counterparts. And then more data supported or looking at WIC and WIC's effect on child obesity and diet would be really beneficial since this evidence was very limited. And then I think it would be very interesting to also look at nutrition education a little bit more, and then specifically at WIC to see how WIC as a program could improve. So thanks for listening. That's just kind of a brief overview of my paper, and then here are all my references that I used. And yeah, let me know if you have any questions, and thanks so much.